Testing, testing, 1, 2. Testing, testing, 1, 2.
in here, but it's out.
Good morning. Welcome to our Division of Family and Children's Services Advisory Board, March 11th, 2025. Thank you all for being here in person, and for those of you that are joining us online, we appreciate that as well. I am standing in today for Jennifer, and we just ask that you would keep her family in your prayers, as I know she would like to be here today. We'll go ahead and move to the attendance reports. I will call the attendance by region. So Region 1, Pam Clayton.
Yes, good morning.
Oh, hi, yeah, excuse me, I did not know you before. Region 2, Fran Chastain. Not present. Region 3, Randall. Region 4, Belinda Davis. She's online.
I'm here. I'm on Zoom.
Okay. Region 5.
Can you hear me?
Yes, ma'am, we can. Region 9, Travis Niblett.
Here, present.
Region 10, Mr. Tommy Hill.
Here.
Region 11, Lacey
Lacey.
Tippins.
Lacey Tippins, Region 11, I'm on Zoom.
I'm here for Region 12, Allie Christensen. Region 14, Shandina Morris. Not here. Okay. Then our members at large, Janice Van Ness. Not present.
She's got a new job there, which she's pretty busy.
Okay.
No,
Excuse her.
they're making a lot of, our two counties we joined, we got a lot of changes in structure.
Okay, good to know.
She's busy.
I know our member at large, Jennifer Shimpot, was not here this morning. At large, Jeff Maurer. So, okay. At large, Virgil Costin.
Present,
And at large, Leslie Reese. Present. All right. At this time, we do have a quorum. And I would just like to have an invitation to prayer, if that's okay. You can join me. This is just an invitation if you'd like. If not, just have a mindful moment for the children and families that we serve. Oh God, we are tired of broken systems that break the very people they are meant to serve. Lord, would you help us harness this anger, to channel it into worthy action, to show us what is ours to fix and what boundaries to control, to keep goodness in and evil out. Blessed are those who are appalled at the ignorance that can so easily dominate over decency, honesty, and integrity. Blessed are we who choose not to look away from those that dehumanize, deceive, defame, and distort. We who recognize that thoughts and prayers are not enough. We who stand with truth over expediency, principle over politics, community over competition. Oh God, how blessed are we that we cry out to you. Empower us to see and to name what is broken, what is in fact ours to restore. Guide us to find coherent and beautiful alternatives that foster life, hope, and peace. Help us to use our gifts with one another in unity. Blessed are we who choose to live in anticipation, our eyes ever scanning the horizon for signs of your kingdom, heaven come down as we wait. Amen. All right, we're going to move to an approval of the meeting agenda for today. Please state your name when making or seconding a motion so that it can be included in our minutes today. So today's meeting agenda has been distributed to each of you. Are there any corrections, motions to change?
I move to approve the agenda.
Tommy Hill seconding.
I might have done this out of order, but I do have an amendment made by the chairman. She would just love for us to take a few minutes to restate our purpose and to introduce the fostering trust document. That, if you proceed, you can make a motion. Is that okay?
Yeah, and
Anybody
then
second? All right. With that, we will move to, I just wanted to, Jennifer asked that we restate kind of our purpose, our roles and responsibility as the DFCS Advisory Board. Many of you probably know them, but I think it's important that we remember them at each of our meetings. So I'll just read these aloud for us. The purpose of the DFCS State Advisory Board shall be to support the staff and promote well-being of the state's children. The roles and responsibilities of the state board members shall be examination of current law, rules and regulations, and policy, and to submit recommendation to improve the ability of the division to increase the safety of children, respond to child maltreatment, and ensure the well-being of and timely permanency for children who are referred to and involved in the child welfare systems. To review and recommend administrative changes to policies and programs that are integral to the protection of children and the welfare and public assistance functions of the division. To review caseload assignments and ratios of child protective service workers and make recommendations for reasonable expectations for such workers and the supervision and support needed to perform their jobs. Provide recommendations on improved collaboration among state, local, community, and public and private stakeholders in child welfare programs and services that are administered by the division. Review the division director's report in advance of meetings. Yeah. All right. And then the executive committee would like to move in the direction of fostering trust through just the following practice. And so I'd like to share that with you all today. This might sound very familiar to our member at large, Leslie Rees. But in fostering trust as the advisory board, we would like that when there's a gap between what we expect and what I experience, that I will believe the best about one another. If what I experience begins to erode my trust, I will come straight to you as a member of this board. When I'm convinced that I will not be able to deliver on a promise, I will tell you ahead of time. When you confront me about the gaps that I have in fact created, I will tell you the truth. And that when other people assume the worst of you, I will be and come to your defense. Is everyone in agreement with that? We feel like we can move forward in that direction. Okay.
It would be great to be able to get both of those things.
Yes.
Via email, digitally, as to keep personal. We can make that happen.
You know, this is not the first time we've seen these. When Joe Frank Harris was governor and DFCS ran into some severe issues, problems, he said, how did this happen? How can we fix it? You know, that's probably about as good as you do. How did this happen? How do we fix it? It's what we're there for, to see if we can figure out how to fix it.
We'll continue then with our minutes approval. So approval of our November 11th, 2024 meeting minutes. They have been distributed to you. Are there any corrections?
Well, I was shivering. I got lost in the parking lot. Does that need to be added? Good. I have a driver's license. I know who I am, where I live. You know, I guess we can amend to that.
Anybody?
Pam Clayton make a motion to approve the minutes as written.
Leslie Reese, second.
It is moved and properly seconded that the Division of Family and Children Services Advisory Board minutes for the November 11th, 2024 meeting be approved. Any discussion? Are we all in favor? All opposed?
All in favor?
We're going to now move to our agency reports. These reports focus on projects and initiatives of each of these offices to help us better know what committees we'll be able to discuss. So we'll move first, I believe, to the child welfare update by Lon Robert.
And you don't have to sit in the back. You
Morning, everybody. Good to be back with you. I think last time I was here, I was 1 month in, now I'm about 5 months in, so pretty green, but so bear with me, but it's a pleasure to be with you, and I really appreciate everyone here. And I know you have a lot on your plates, and adding this to your responsibility is very much appreciated. So I'm serving as Deputy Commissioner of Child Welfare. Again, been in the role for about 5 months, but I've been with the state working on 29 years. I've been around in different capacities for a while. Today, I'm going to share some of the observances, events, and initiatives currently taking place in child welfare. We have some prepared statements, then we'll take questions if we have time at the end if you want to do that. So today we'll focus on some of the human side of the work and some celebrations. Start with AFPAG. I'd like to highlight the Adopted and Foster Parent Association of Georgia, also known as AFPAG. It collaborates with public and private child welfare agencies to help improve foster care and adoption process. Educational training for families. Each year, AFPAG hosts an annual education conference. This year's conference was held at the end of February in Jekyll Island, Georgia. There were 409 foster parents and adoptive parents across the state in attendance. This year, DFCS awarded 140 conference scholarships to our foster and adoptive parents. These parents were selected for the continued commitment to Georgia's children and youth in care. While at the conference, our caregivers and staff participated in sessions and workshops that provided valuable opportunities for education and support. AFPAG selects a case manager of the year to be recognized during the annual conference. Michelle Stinson, a DFCS social service specialist in Region 9, received Case Manager of the Year for 2025. Michelle's been with the division for over 20 years, and her hard work and dedication to serving Georgia's most vulnerable is truly admirable. We're incredibly proud of Michelle for this honor. Building on that, March is Social Work Month, a time to recognize the outstanding social workers who are dedicated to assisting Georgia's children and families. In February, we asked our district, regional, and county directors to nominate social workers from their teams who exemplified compassion and service. We received countless stories of social workers from across the state who've gone above and beyond to serve our families. It's always good to highlight the human part of the Department of Human Services. We're going to focus on some of these case managers. We're able to interview these nominees. I want to share a few of their photos and stories with you all today. When asked what brought him to the field of social work, Garrett Pierce, one of our crew caregiver recruitment retention unit administrators, shared, which is resource development. Initially, a friend encouraged me to apply for a position at DFCS, which led me to start as a case manager in 2014. While social work was not my original career path, I the significance of the work I was doing. Connecting with youth in care and foster caregivers helped me understand the profound impact this field has on children, families, and communities. I discovered a passion for matching children with foster parents who can meet their needs and provide a nurturing environment for them to heal, while their biological parents work on healing and completing their case plans. So shout out to Mr. Pierce. We asked social service specialist Shana Francois what strength she brought to the career field, and she stated, "One strength I bring to my career is I can build trust with clients through empathy. My goal is to create a safe, non-judgment space for all families to express themselves, which allows for an open and honest communication. I try to make the process as comfortable as possible for them. I believe when clients feel their voices heard and understood, they are more prone to receiving help and making appropriate and sufficient changes in their lives." So we want to recognize Ms. Francois for her great dedication and service. When asked to share a time when she transformed the life of a client, foster care case manager Chelsea Hasty said, "In a previous case, I had a mother who was able to secure housing, but was unable to furnish the apartment with items needed to reunify with the children. With donations from the community, I was able to help this mother fully finish her apartment, including items the children needed. After all the items were gathered, I helped transport all the furniture, kitchen items, and additional household necessities to her new apartment where I helped her set up everything. Ultimately, the children were successfully unified with their mother." That's a great story. We thank Ms. Hasty for her work. We have one more. We asked Stephanie Scott, a social service specialist in the adoption unit, to share a story about her clients, and she shared, "My favorite clients are my teenagers. I loved helping them feel important by encouraging them to talk to judges, helping them to write out their thoughts prior to hearings, and teaching them how to dress appropriately. I love helping them attend their proms by finding a sponsor, helping them set up nail and hair appointments. I love empowering them to continue learning on a college pathway by attending their independent living program meetings and purchasing that college t-shirt for items when they receive their acceptance letter. So beautiful, and we want to thank Ms. Scott for her service to our teenage population. These are just a few examples of the outstanding individuals who are working within child welfare. I encourage you all to follow our social service media pages throughout March as we highlight social workers across the division within the DHS. So building on Ms. Scott's, her comments, we'll talk about Teams Are For Me. This past weekend, we held an annual Teams Are For Me conference. The Teams Are For Me conference is designed to strengthen engagement with youth in care between the ages of 11 to 17. We had 68 child welfare professionals participate in the Teams For Me Adult Day. Throughout this portion of the conference, child welfare employees attended workshops on serving youth with complex needs, youth engagement practices, transition planning for teens and young adults, and ways to avoid burnout. There were 95 youth who participated in the Teams For Me conference. These youths participated in workshops on a variety of topics, including cooking, budgeting, and conflict resolution. 25 vendors were present and provided valuable information on post-secondary education and employment opportunities. The Georgia Department of Driver Services was also present and able to provide 15-year-old youth on-site state IDs, which is wonderful. As a fun end of the conference, our youth were able to attend the Atlanta Hawks basketball game. This year's conference was a great success, and I'm thankful to the over 30 staff and volunteers who dedicated their time to attend the Teams For Me. We'll hit on a couple of pilots. The QRTP, the Quality Program pilot, it's a part of the Family First Treatment Program. The Family First Prevention Services Act. We executed a contract with Murphy Harps in Cedartown to pilot our state's first qualified residential treatment program, QRTP. Again, this is part of the Family First Prevention Services Act. It's a big step. We're very proud. A small step, it's a really big step to get this going. These facilities will be a vital resource for children with complex mental or behavioral health needs, providing step-down resources from crisis stabilization, psychiatric residential treatment facilities, or partial hospitalization programs. The 10-bed facility for boys opened on January 27, 2025 is now at capacity. So we'll keep you updated as we continue to grow the QRTP program. Very good start. And the Housing Choice Voucher Program. The last item I want to highlight is the Housing Choice Voucher Program. Our departments continue to prioritize housing needs of young adults as they transition from foster care to independence. The Housing Choice Voucher Program, maybe referred to as HCV, has been critical in meeting this need. Housing Choice Vouchers are funded by the U.S. Department of Housing and Urban Development, or HUD, and are administered by the public housing agencies in the form of the Foster Youth Independence or Family Unification Program vouchers. Our Foster Youth Independence Voucher Program provide housing assistance for youth in foster care between the ages of 18 and 24. Our Family Unification Program provides assistance for youth in foster care between the ages of 18 and 24 and families in the process of reunification. We currently have 6 partnerships with housing authorities across Georgia, including Atlanta Housing Authority, Brunswick Housing Authority, City of Carrollton Housing Authority, the Housing Authority of DeKalb County, the Housing Authority of Noonan, and the Housing Authority of Savannah. There's some big players there. We're also partnered with the Department of Community Affairs. Each public housing agency is only awarded 25 vouchers per fiscal year. It's DHS's responsibility to prioritize youth based on the need and the appropriateness of the referral. As of January 2025, our well-being section has assisted in securing 33 vouchers for youth. This is an incredible accomplishment, and I'm eager to see this number increase as 2025 continues, and we'll continue to keep you updated on it. We have dedicated staff working on this effort, and they continue to reach out to additional public housing authorities across Georgia to develop additional relationships to maximize this opportunity. And so with that, that's the end of my prepared statement, but I'm open for questions or any comments you'd like to share. Yes,
I have
ma'am.
questions.
Certainly.
For the Qualified Residential Treatment Program pilot, this is for kids with complex behavioral needs, especially teenagers. It's an incredibly challenging. I've been working with a lot of families who are having a really hard time. And in fact, there's one particular 14-year-old boy I'm thinking of But out of 5 of the 6 AmeriGroup facilities denied his entrance, and had the 6th one done that, what were they to do? So was adopted through foster care. But I'm just curious about this, the 10-bed facility, like, are we looking to do more beds or more facilities, or how do we help more than 10 people?
Right. I think now it's conceptual, right? Right now it's conceptual, state funded, we're using state dollars to pay for it now. Ideally, it'd be federal dollars you can draw down to pay for this. So we're trying to just get a proof of concept up, see how it works. We're currently working with AmeriGroup and DCH and trying to work with our partners how we can build this and scale it out. So right now, I think it's just, we got it up, right? Got one up, see what it looks like, monitor it. So it's a true pilot in that regard. I think funding certainly been a very important part of it. So we're working with a lot of meetings with AmeriGroup and DCH, how we're going to make that work, but they need to make that, for be able to build directly. So more to come on that, but it's a lot of hands on deck trying to make that, bring this up. And so it won't be something we'll flip a switch and we have 400 beds, but it's not, I think we'll scale and grow and continue to see, but it's kind of new. It's a new concept. I mean, it's sort of a new concept. For sure. A lot of it's bringing up awareness. Certainly resources are very important in trying to place these difficult, hard to place youth with difficult behavioral challenges. And so this would be a great resource for us, but I'm just glad we have I hear what you're saying, I agree. Glad we got the 10 bed up and we're trying to work with other partners and scale it out. So
what is the, how long are the kids staying in this? Is it long-term, and what does long-term look like?
it should be more intermediate term, and I can get you more details on the pilot.
Like 30 days, 96 months?
I'm drawing a blank off the top of my head now, too much. I'm sorry. I believe it's looking at 30 days, but I'll get you
Okay.
more information about it.
Just curious.
My apologies on that.
No, that's okay, I'm just curious.
Lon, also on this, what are the benchmarks that you have to meet in order to start pulling funds federally?
I'll get you on that, because I hate to say it, but a lot of.
It's just that I know that, Families First funding has been slow coming.
It has, right.
And so, I'd just be curious what we're close on, and then, how big the gap is to get to the point where we can actually.
I work with Melissa Barwick, who's I think we've met her before, financial guru, brilliant. And so she's working with us closely, Ryan Pedersen, a lot of players involved. So we're trying to, I'll get that for you, but it's might be a moving target, feels like a moving target right now, some ways, right? We're trying to nail it down. I'm trying to go ahead.
Okay, I just have, on that regard, is there a trauma responsive model that we're following, in that pilot? I know the need. I also really want us to be, moving in that direction of, residential requiring some level of trauma responsive model being selected by the home. I had a child this week that was working, similar, she would probably qualify for this program, but was working to get to take out the trash. That's not trauma responsive. We have got to do better there. So I would love to see just that this is a pilot, this is where we're headed, what the trauma responsive model is there, if you don't mind.
Yeah. Maybe we focus on next week on more on the DRCP. We'll have more information next time we meet and get better.
Okay. Was yours regarding that? Was your question about the cure? I have another question.
Well, I'm interested in funding, you would go ahead.
This is much lower level. I would love to be able to write letters to the recipients of those awards, from the advisory board. Do we have stationery or something? I mean, I can just get something, but.
We can work on it.
Okay, I just think that would be something nice, that would be meaningful to me if I was in the field. And then also I wonder how we can leverage, those were like really, those quotes were very specific about their job and, like made you want to do their job. And so how are we leveraging those for recruitment purposes? Those individuals and their testimonies, specifically.
Yeah, I think that's real.
I would love it if our local career administrator felt that way about her job, like how are we leveraging those? What about, how do we find out what counties do not currently have an active AFPAG? I recently looked up ours and I was connected with someone that served in 1992 and she was no longer active. So does anybody know? Because because that's such an important arm of this work, and I would just love to know what counties currently in my area don't have one and how we should work.
I'm concerned about the funding, as I have been for many, many years. It's wonderful that we have got a 10-bed facility in Burke. By the way, I think that's the best I've ever been to. I've been to these facilities in 20-some odd states. Berkeley Harpston are the best that I've ever seen. But funding for mental health, when I was general court judge, if we had to, instead of getting a little tiller to work the garden, we had to get a Caterpillar bulldozer to move things and to get these services. So you are getting it now, but there is not, and there's a trend in the federal programs towards less treatment for mental health. And I'm assuming from what the governor has said and the legislature said about our budget, that we have state money that we could use if we can't draw down some of those federal funds. Just continue to support the kind of programs you're talking about. Because I think they're extremely important. And I speak for those who've been in leadership positions trying to find places for them. It is not an easy job. It's probably the most difficult job that any social worker has, is to find a place for a hard to place child. Now, the other thing I wanted to ask about was the support for children who are aging out of foster care has come, I think, over the last 25 years, it's come full tilt. At one time, there was almost nothing, and then the senator from Rhode Island, I think it was, died, and the legislature decided to give some money to his own, and it's continued. But that is the one thing that I think that we know little about. We can look at the day-to-day activities of the Department of Family and Children's Services here briefly, but I don't understand. I don't know. I mean, it's just an ignorance on my part. What's happening to these kids? Because at one time we just said, well, here's your little slip, get the doors over this way. And that was the only offer we had, was say, we'll say a good thing about you if you go somewhere. But I know now you're helping get kids in college. You've got vouchers for them to stay places. I'm just not not convinced there's enough. I don't know.
It's not me to take your.
No, go ahead, numbers on
But there's a lot of change that's happened as a result of the Fostering Success Tax Act, where people can get a tax credit if they will put money toward that particular cohort. The money on that side also struggles to flow sometimes, so the flow problem seems to creep in along the way. But I think there's also legislation this year trying to expand the Fostering Success Tax Credit Act so that more educational avenues are open to these kids, and they can get mental health services, they can get assistance with housing, pretty much any kind of tangible need that they have if they're between the ages of 18 and 24. If they know about the program and.
But see, there is that darkness that I look at.
And I would say, if that program is an echo of Georgia Gold, which was put in place many years ago for private schools. And I think one of the biggest challenges that we have with Fostering Success is that private schools have an affinity group, people who love the school, who want to keep giving to it. We're having problems getting Fostering Success visible and getting an affinity group that wants to give that direction. So that could be something
really
that we as a group, could take on as a challenge, is and DFCS doesn't have a direct role with Fostering Success, but DFCS has the mantle that might be more effective for making it visible and making it go better, go faster in terms of the funding that's in it. And then if we can figure out how to get the money back out of it, even better.
So I appreciate it. We can, again, next week.
Well, I think you do. All of this is coming from a little hole in the ground to a great big volcano. And I think DFCS and the people who've made this possible should be congratulated. There's never enough. I know that. I'll stop. I did want to ask you if you go back to Jekyll Island, go to the Turtle Center. My granddaughter is the nurse over there. So.
this is a little bit in the weeds and you may, maybe not be able to, read, but on the fostering success tax credit and the Georgia Gold, is there the individual cap for each, program?
What's
or is
fascinating, well, what's fascinating is Georgia Gold, because it's so much more successful at getting its audience, you often are limited. You can't get your whole 5,000, but what's happened the last 3 years with fostering success is when they get to July and it's not fully subscribed, they remove the cap. So you can work that into other organizations, above the $5,000 limit. And it's dollar for dollar tax credit, but people don't know about it. And how do we get that? How do we get that word out there that the state is willing to take state tax dollars and apply them to an interest area that a particular individual has? And then how do we get more people interested?
Well, and seeing that as a prevention service,
Yeah.
right? Because that's the script that I've been trying to build in our area is investment in our aging out youth. Is in fact prevention.
It is.
One of our greatest measures of prevention.
Yeah.
And so, I would love to, on the other side of that, connecting those youth that are aging out with the resources. Who would you say, Mr. Milan, is like ILP, like the head best person in our area? Like, I mean, I know y'all are tired of me saying this, but like south of Macon, things just don't run the same, right? And so I'm really trying to figure out best practice in the state and giving that to all of our county. So who is really doing that work well of connecting our aging out youth with all the, I mean, this is the first that I'm hearing about.
I mean, Don J. Calhoun that comes to mind as head office, he's phenomenal, and total confidence in Don J. I can certainly reach out to Matt and to Don J. Monica Scott as well. Right.
Okay.
There's some great heavy hitters who do a really good job in this population. I lean on all the time. We really know it, know the ins and out of it. So yeah, Don is great.
Can someone send us all more information about this? Like, I've heard of the Fostering Success Act, but not about all of the details.
Yeah, sure.
I also have one quick question. So what about the kids that don't age out of foster care, but they spend a significant amount of time in foster care? There's no resources for that. They're not
If
covered.
they're in care for more than 6 months, I'm sorry. If they're in care for 6 months after the age of 14, then they qualify for educational support.
But
Whether
if
they're adopted.
They were 13
Or
now.
whether they age out.
Correct.
13 now.
Okay.
The way the current policy stands is 6 months after the age of 14.
Okay.
So that sweeps in a fair number of kids. Lots of kids re-enter care in those teen years too. So, you know, they may have been adopted in an earlier stage and unfortunately find their way back in care later qualify, but yeah, it's 14.
Very knowledgeable board. I love it.
I think these affinity groups you're talking about are very important. And there's a number of private schools in your state. They appear to be the honoration of the kids that are going out of foster care. Maybe they shouldn't be, but they need affinity groups a way of getting those boards.
We have to get people to figure out about this and that they therefore want to put their tax dollars toward it. And then just keep strengthening the system of how the money flows in and out of that system as a support to DFCS, because DFCS can't afford to do all that is needed in all the places for all the kids. But there's $30 million sitting in the vat that we can't do about, so.
Yeah, you can get to that.
Yeah.
I appreciate your time. Thank you very much for your support.
Thank you.
Always here for you. Feel free to reach out, anytime.
Yes, sir.
Thank you so much.
All right, we'll move now to the Office of Family Independence update by John Holman.
Thank you for the introduction. Again, John Holman, Deputy Commissioner over the Office of Family Independence. I have a presentation here today, and on the next slide, you'll see there are two things I plan on hitting. We're going to talk about disaster SNAP and some enhanced recent changes to the Gateway provider portal. I would like for this to be a conversation, not a presentation, so feel free to raise your hand or just interrupt me if you have a question.
Well, I want to ask if you're still all over the place. When you talked to us last time, It appeared that y'all just got thrown to the wind.
Yes, we did, and that's why I wanted to start with this. I think last time, I went over some of this about DSNAP before. We were right in the middle of it, and now it's been done now for a couple months, but I did want to close the loop on this just to make sure y'all knew about kind of what happened and how it went and some of the things we pulled away from it too. So that's where I'm gonna start today. So thank you for helping me with that transition there. This real quickly, just overview of the program in the wake of Hurricane Helene. There is a program within SNAP that allows us to administer emergency relief to folks in the form of money for food. Anybody who is, or folks who were affected by the storm, can use this to offset some of the expenses that they incurred. So you don't have to choose between getting a tree off your house or putting food on the table. This is a great program to do both. And so it serves both existing clients and non-SNAP clients. Existing clients are given the opportunity to receive a supplement. So in SNAP, you don't just get it or you don't. It's a spectrum, and based on a budget, you get more or less money. But with DSNAP, you're allowed to give everyone the maximum allotment. So that's what we mean when we talk about supplements. And then people who are not currently in the SNAP program will get, a one-time cash benefit to help them offset some of those costs from being affected by the storm. So on the next page, or next slide, you can see on a map. I think maps are very powerful. You can kind of see the path of the storm. As it did affect more parts of the state, but that eligibility to be a county that was eligible for DSNAP was based upon a presidential declaration of disaster. And so when we were looking at this, and trying to plan, they were adding counties as we were planning. So it was very, very difficult, but by the time we kind of solidified a group of counties we were going to serve, it was estimated that there would be over 500,000 households eligible, which is the biggest DSNAP operation that's ever happened in Georgia. Just to give some context, we did one for Hurricane Michael.
How does that compare with the numbers that are affected nationally? That just sounds like enormous number.
Yeah, well, there was in South Carolina and North Carolina, a lot of people affected too.
Yeah.
But the population of Georgia is very high. So we were,
Well, I think that had something to do with it.
yeah, I think Florida kind of got the worst of it as they usually do. They're more used to that kind of storm though too. So I think that, Georgia and North Carolina certainly were two of the most impacted states because, Augusta doesn't see very many hurricanes. The way
Yeah, it was terrible.
It was bad. And I got to see a lot of it firsthand along with the staff as we went out through these things. But, thinking about those numbers, just how many people could potentially be eligible, there was no way for us to serve them all. Like the federal, there's a lot of rules around the program set by the federal government. And we have between 5 and 7 days for people to apply. And in order to be able to serve that many people, we broke it up into 4 phases. I think I was on phase 2 or 3 last time we talked. But we went through all 4 or 5 of those phases. We had about 1,200 people from the agency working at any time. But this is just a map to show you, and we listed the counties out here. On the next slide, though, is where I'm going to spend most of my time is kind of giving you some numbers. I think last time we talked about the different places we were using. We relied mostly on churches because we were competing with a lot of the other places there were polling places at the time because this was election season, if you remember. But the churches, agricultural expo center, we used an armory for one of them, and just a lot of people really stepped up to get this done. We used a bunch of different creative things, but overall we were able to push out over $125 million worth of benefits to areas that really needed help. So very proud of that. Staff did a great job making this happen. We ended up serving 176,000 households, which represents over 400,000 people. Staff benefits, one of the things that's really great about them, the multiplier effect is much higher than that $125 million. They're going to spend that money within their own communities, and that's how the money gets multiplied. So it was, probably the thing I'm most proud of that I've ever done as a person in public service. This is a really amazing thing.
But this is.
It really is. And staff really, Lon and his team really helped out too. One of the big things that It was great to see the whole agency pitch in. Child welfare wouldn't have been able to do without them. They sent over, I think, about 500 people. I have some staffing numbers too. You know, it did 1,200 people added things. So we had 2,080 individuals that contribute. 2,333 of them are from OFI. Child welfare gave us 471, and child support also gave us 76 folks. There were over 1,500 people who served in more than one phase, and over 1,000 people that served in every single phase. So it was spread out over the months of October and November, but it was a really, like, those people had to be away from their families for that time. And some of the folks, like, really heartbreaking, or I can't decide if this is like sad or motivating. But one of the workers we found out, you know, had been affected by the storm. Well, they lived in this area, so one of our workers was living out of her car and working decent all day during the day. And as soon as we found out that, we got her some help, so she, you know, could have a better arrangement. But just the dedication of the folks was amazing. You know, it was really awesome. So I wanted to share that with y'all. I have some pictures here too that I know they give y'all these slides so y'all can look through them. But here's some. I think that's one of from a school in Augusta, and then the Agricultural Expo Center in Moultrie. On the next slide, we have some. I was going to brag on one of our board members. I know she couldn't make it today, but Jennifer did come down to come see that. Some DHS leadership showed up too. You know, it was great to have, like, when you hear numbers like that, it's hard to really understand them. So you see them in person, but it's really a very large thing that happened, and, you know, very good for the state, I think. So we're very proud of that. Just wanted to tie the loop and share some of those numbers with y'all.
I've been hearing some really difficult things to hear about what's happening in other areas for people who, you know, I thought COVID was over several years ago, but obviously people are still working at home because of the COVID. And people are having to come back to work, and they're either overwhelmed or they're not prepared for it. And this business of applications, it's unbelievable how much y'all looked at and how many you were able to work with. I don't think the federal government and this state can compare. I don't think there's a good comparison, because they've had more problems getting people back to work to do exactly what you did by going out there to look at it. You can't sit in an office all day and wear a nice tie and get much done. That's why I'm so useless. Have a nice tie.
Yeah, and it was kind of humbling to go to some of these sites because, you know, I am more effective, you know, behind a computer than, you know, out there at a site. But I would like to, I did try to go. I went to every site and spent a lot of time out there to make sure I understood the things I was asked to approve, and you know, help direct resources as best we could. But it was a lot of the feedback from the staff was things that you said. You know, they really enjoyed. You know, a lot of our folks work remotely now, and so you lose some of the connection when you're either not even talking to a person who's processing.
Well, except for us, nobody knows you're doing this.
Right.
And that troubles me, because I've been fascinated with a number of different environments, all of which were foreign to me, and also which I was like a tadpole that was in one of the endangered species. I didn't know what was going on. We don't hear this in the national news. We don't hear it in local news. We don't hear it on state news. We don't hear anybody that's blowing the horn. And this is, given what's happened in many environments, this is the most impressive thing that anyone could have seen. Anyone.
That kind of, in a little way, loops back to what we talked about last time, which is how can you leverage your methodology for choosing areas and also some of your successes from this in a public way, so that the next time someone who is in phase 3 understands why.
Yeah, you didn't ask them to come to an
also
office.
understand how effective you guys are and how dedicated you are to getting to the end. So it does feel newsworthy, maybe.
I think it's important that we talk about taking the office to the consumer, not asking the consumer to come to the office, because you took the office.
Of course, so y'all advertise all the bad stuff. So why don't we advertise something of this magnitude?
Yeah. Yep, we did during the time get some very positive press coverage. That is something that rarely happens, so I was happy to see that. It was mostly at a local level, I will say, which is unfortunate.
Yeah, because around Atlanta, unless the kid dies in your care, nobody looks at this.
Right.
We'll look at this.
Thank you, I appreciate that.
Thank you very much.
It all the credit goes to the staff. They really stood.
No, I understand that.
Well, I think
Leadership, especially within child welfare.
it's your smaller community, did we advertise in the like, smaller communities like Region 10, Region? I think it'd be more effective that way because that's what it reached out more to all, right? In smaller communities. If you could advertise something like that, put a picture of something in the paper just to show the results of what you did. You know, I think people
I was impressed at the last meeting. I am really, really, really impressed now because everything you said you were doing has been done. Now, I don't mean you were 100% successful, but how many people, FEMA or whatever is out, how many could do this? When they're still trying to clear the streets over in Augusta. Y'all gone out there, they're probably clear about that.
Well, I appreciate your confidence in the team. They do deserve a lot.
Don't go over
And one of the great things about the disaster center does have a lot of control over it, and a lot of things that we're challenged in our other parts is external constraints that limit what we can do and what we like to do. So it was nice to have full control over a project and be able to execute it successfully. So it was really good. Good success story, and I wonder how much goodwill I'll be able to keep going with this. It has been 4 months. So this may be my last presentation here, but I have been trying to promote, the success of the program. Our federal partners were very impressed with us too, and we've been lifted up as an example for the country moving forward too. So it's been great. So we had some really good small things that made a big difference, like the hats and the vests you saw. Our, FNS is now using that as a best practice for states running DSNAP. I ended up buying like 400 iPads that I was going to put into kiosks in our lobbies, but the stands were taking forever to show up. So I took all those and deployed those for DSNAP and used them to register people in line before they set up the process. So that also, I'm probably gonna buy some more if there's any money left over at the end of the year, to keep around just for that. But we're going into lobbies as we speak now, as like a pilot, which I'll present on our next board meeting and talk about those. But some things like lined up really well. Because of COVID, the federal government started approving virtual operations, so we could approve a lot of people with the phone too. So a lot of things lined up, along with staff just doing a great job to make this success.
Well, I've been doing this in some shape, form, or fashion since the early 80s. Never seen anything like this. I used to work with the Children's Bureau. They never showed anything like this happening in any of the states. They just looked at the problems, not any solutions. And that's what I think is so important. You can point out problems. I could probably point out a few or dream up some anything. Give you solutions like you just shared. And I'm not talking about you individually, but I know this is a community effort. It's a community of whoever you had working there. Because Jennifer in the corner up there, you've managed to get people in to that office that you took to them. I wish we could learn from that, though. Taking the office to the consumer is never done except you've done it.
Well,
thank you.
You're welcome. Thank you for your kind words. It was a great experience, a great project. Happy to be able to help out with this every time we meet. I did have one more thing to talk about though. I know I'm probably already over my time. Sorry, organizers. But the one thing that happened from the public health emergency and the Medicaid redetermination process was a lot of folks weren't as close to the renewal process as they had been. Normally people would have to renew their Medicaid benefits every year, and they're used to that timing of that. And some of that changed as we went through the Medicaid redetermination process. Folks hadn't had to go through that renewal in 2 and sometimes 3 years. And so one specific thing that came to light during that process was that we have you can access Gateway a couple different ways. There's just the customer portal where people go to apply. There's a partner portal that we have for our community partners to help people apply on their behalf. And then there's a third one called the partner portal where providers can log directly into Gateway to manage the clients to view the status and try to manage the clients that they serve. And in many cases, they're an authorized representative for clients who, their medical condition prevents them from being able to do this, or family situation or something like that. So what came to my attention was that the provider portal piece, you could only kind of look up one person at a time, and it wasn't really designed for the way that people use it. And so a big project that we did over the last year was to enhance the provider portal to be more helpful for providers. So mostly nursing home providers weren't the only people who went through a lot of turnover during COVID. And so new folks trying to navigate the new system wasn't really working out that well. And so trying to make the system better for them. So what we did was we changed the provider portal. So now instead of just looking at one person at a time, it displays a dashboard to providers that shows them all their clients within their facilities. Makes it very easy for them to tell when they're up for renewal, when something's pending, if they need to submit something. They can export it via Excel. They can submit changes if they need to very easily through the portal. At least I hope so. On the next slide, we have some feedback. We engaged with the provider community for the design of the system. We actually had some people who work in nursing homes that have to process these type of documents help us in the design. They also help us in the testing. And then we had the help of, thank you, the Georgia Healthcare Association to help us spread the word that it was going live. And we had 83 new providers who weren't using the system at all ask for new access. We had 150 that were existing providers that wanted to add new users. So that shows me as a system enhancement that I hope will continue to be successful. The people are excited about it. It's, just making that process better for them so they can view their existing clients and help keep them in the system. Because that was a big pain point that we went through during the redeterminations, like making sure that people know they have to submit things, when they have to submit things, and when it's the providers can be very helpful in that process. If they're not the ones doing it, at least kind of reaching out to the families of their clients to help kind of push that stuff along. So, we have monthly calls with the providers at the district level. So we're trying to use those to kind of push this new thing out and offer training and answer questions. And I hope to do more. Maybe set up a call or a live demo or training or Q&A with the help of the Georgia Healthcare Association and other partners through DCH as well. But this is something that I hope will make this process better for folks and reduce some of the churn that really slows us down and causes issues with the environment. So, any questions about that? I know that.
So not a question specific to the portal, but
Sure.
you all were moving through at the district level a reconciliation process, I think was the term that it was labeled.
Yep.
How is that going?
I think it went well. So I will talk a little bit more about that. So there were, because of Medicaid redetermination, some of the challenges we saw specifically with nursing homes, folks falling off that should fall off. Because we don't ever want anyone who's eligible to become ineligible because they'll just come.
You don't have any 150-year-old.
Right, and not that I'm aware of. So, just making sure those folks who are in place to stay in place. So we saw a lot of challenges with that. So we paused the closure of nursing home cases for folks that failed to renew for a little while until we could do a couple of things. And one of them was this provider portal enhancement so they could have better visibility into their clients and how to manage them. But another one was just, we worked with our vendor Deloitte to just export everything we have for each provider. And that's what Pam's mentioning. We call it the reconciliation process of saying, hey, here's a list of all people I know that are in this facility at this location. Can you look at it and tell me And we gave some instructions too, that like, if there's somebody who's on here who shouldn't be, this is what you need to do to get them out. Or if there's someone that should be that's not here, this is some general things you might have to do too. So that went pretty well. You know, not everyone was responsive, but most people were very happy. Like I was actually honestly expecting a lot of pushback, but everyone was just like, this is great, thank you. Yeah, and I think it's visibility
Yeah, I
too.
think that's right.
Because they had to look their clients up one at a time and, you know, just keeping track of that may not be so difficult. So I'm hoping that this gives them more visibility into their Medicaid clients, that population. But that was like a first step, like, let's do a manual process to make sure everything looks good. And then once everybody was in the system in the right place, we did that reconciliation process. We did a redistribution of the cases, the renewal over a 12-month period by district. So, because they either work kind of at the district level staff, we don't, whether they're on a statewide model, we don't have to. But, so those folks don't get overloaded. And then we gave people visibility into all that, we resumed the closures for failure. Because we have, we're like supposed to do that. And we were given some flexibility by CMS deposit while we kind of resolve the Medicaid redetermination process, but that's kind of over. So we had to be in compliance, we have to do their manual rules, but hopefully now they at least got that catch up. So now we have a tool to try to make it a little easier for folks to manage that process. But it's, you know, ABD, A-Fine, and disabled Medicaid is very complicated, and there are a lot of rules and little things that have to be accounted that make it challenging, but at least trying to provide some additional visibility to reduce some of the issues that we have.
Now,
Very
maybe,
excited about this.
maybe you should ask Emma to help you with that. I know I would never get through these gateways that the state has every year. What do I do with this? How do you? Of course, I'm different from the rest of you. I'm old and decrepit, but you know, it's hard to maneuver through some of these systems. You don't have some background.
It is.
And the fact that you're getting through them is certainly impressive.
Yeah, and next time we talk, we have another project that's kind of a refresh of our customer portal that we're working on too, and hopefully I'll be able to present on that if we're further down the line with that, but trying to make the application process as easy as possible for folks too, so they can navigate through that with, you know, access to kiosks in our lobbies and kind of making the website itself a little bit more friendly for our mobile users and putting in some nudges to help guide people in the right direction. So I'll present hopefully on that for the next board meeting that we will follow that.
Any further questions? Thank you.
Yep.
At the risk of sounding, like I've missed a meeting, which I have, but speaking of the technological advances and the help there, what was the pilot that we talked a lot about last year? It was on the child welfare side. Does anybody remember? It was a pilot of trying to put, some of these technology pieces around casework so that we weren't losing as many files. What was it called? N-Case, okay, and how is that, will we get an update on that?
I will have to get with Juan.
Okay,
His team.
it just like came to the top of my head, I would love to hear an update on that project. Okay, we're gonna move to the legislative updates within the.
Thank you again.
Oh, yeah, of course. And it's a little difficult to follow John talking about internet efforts, but excited to be here with you guys in person this morning. Hopefully our board members are very familiar with me at this point, but for anybody online, my name is Helena Philla and I serve as Director of Governmental Affairs for DHS. And as you all know, we are in the middle of legislative session in Georgia right now. Today is actually day 30 of 40 days. So we are deep in, so it's the perfect time to give you guys a little bit of an update on our agency legislation. Next slide. Okay, so we have two bills this year, and I'll start with this is sponsored by Senator Kirkpatrick, who is the chair lady of the Children and Families Committee in the Senate, so a perfect sponsor for us. And this bill works to clarify the existing authority of juvenile court judges, so this already exists. But it just gives a more laid out version of what exists, but it allows juvenile court judges to issue warrants when evidence is presented in a court that establishes probable cause that a person has violated law. This is called a court of inquiry, so when they're testifying, they may system about child abuse or something along those lines, and it would allow that judge to be able to use their discretion to issue a warrant, based off of their testimony. So currently, juvenile court judges are not included in one section of code, but they are in another. So this just clarifies, and adds them to both provisions, just so all juvenile court judges are on the same page.
And if this goes through, I hope somebody gets together with the people that train juvenile court judges, because they don't know a lot of this.
We've worked very closely, with them throughout this process. We kind of presented this to them at the time, just to make sure that there weren't any problems on their end, and they've attended committee meetings, when this is being discussed. So, we're excited to partner with them to make sure that this.
But some don't realize they need you arrest warrant period, so, yeah, this is an improvement.
Absolutely.
And I know the senator, I think she's done a good job. Some of the things I didn't like, but.
We're grateful to have her as a partner for our agency. She does a lot for, our agency legislation and, just kind of moving the needle on what we're able to do as an agency legislative wise. So like I said, the goal of this is just add the appropriate language in all relevant pieces in code. This bill is passed through the Senate completely, and it's actually passed out of its House committee, so it's sitting in House rules right now. So we're anxiously awaiting this to be voted on. So it's looking very, very good for that bill. So next slide. And then our second and last bill that I'll cover today is Senate Bill 98. This is a little bit outside of the realm of what we typically talk about, and this comes from our Division of Aging Services, but wanted to give you guys an update on this. This is sponsored by Senator Bill Calzert. And this bill, another kind of cleanup bill, it really clarifies two terms that are in Title 29 of Georgia Code, County Guardian and County Conservator. They have different responsibilities, but they were used interchangeably in code. So this just clarifies the role of a conservator, which is more on the financial side, while as county guardian is typically personal health kind of decisions. So this bill is also passed completely out of the Senate chamber and is sitting in its House committee awaiting. We're hoping that happens in the next week or so. Next slide. And that's all for our agency legislation, but I'm happy to take any questions on those or.
Into this also, this conservative guardianship, I think that may not help the agency very much, but will help other people. Because up until last 20, 30 years, guardianship was a classical person property, and a conservatorship came along, which has always been out there. We just haven't dealt with the term. I think this helps to clear up some of those issues.
Yeah, our Division of Aging Services and how this kind of came to be, heard that from a lot of counties, a lot of constituents that they serve. So we're really excited to see this come forward and are hopeful that it will. He does. Really great partner. Any questions?
Okay, we're gonna move on to our board business, moving first to committee reports. So,
Is it possible to take a the bathroom? Have we called a bathroom? Can we have a quick bathroom break? Can I?
yeah, or I guess, but I don't wanna be.
Randall has made an
Yeah.
important motion.
Yeah.
The last holdout has been seated.
We're at committee reports. So how about we start with community relations and hiring? Randall, do you want to report out?
Sure.
Okay.
So I think we've changed our, we've taken hiring off, so it's community relations. Correct. Okay. And we did not meet, I think we're in the process of clarifying leadership on the committee. So I think that would be important to move forward, but we did earlier today have a presentation by Martha Watley. That's said her last name, right? And that was interesting, just some different initiatives that are going on that their team of people are involved in in the community. So I don't know if I need to tell you what those are or just tell you that they exist. Yes. Okay.
What is and I'm just curious what is the cadence of like your meeting structure? What are you all meeting?
We are not meeting. That's I
Okay.
think that's what we need to clarify.
Okay.
So
Is there an expectation around that? Like,
No,
is
it's
it
set as needed,
Okay.
by typically the chair of the
Okay.
committee.
yeah, so we probably need to have a conversation.
Yeah.
I think we kind of did, Travis and I did, but we were the only ones here today. So
Okay. What about OFI? Who would like to report from that committee?
Again, we met in January. Our goal is to try to meet at least once between meetings. So we met virtually in January and then again this morning where Laura joined us this morning. Still, January was just kind of after DFCS conclusion. So still some kind of ongoing discussion around that. And then our goal is to kind of learn more from a committee perspective about particular initiatives. Today, there's a little bit of a focus on current needs within benefit fraud from like a vendor perspective, vendor prior to recipient perspective, which seems to be an ongoing, not unique to Georgia situation. So following up a little bit more about kind of the ins and outs of what's happening in that. But
You may want to talk to I don't mean the people, folks who are kind of in county, but the two biggest fraud areas in the country used to be down around Brunswick and Miami.
He's trying to tell y'all things aren't right.
No, I mean, that's just, I knew a fellow that was in the U.S. Attorney's Office, so that's directly from him. He's prosecuted a lot of those cases. They're unbelievable, they really are.
I was just kidding. You were working. Okay, Leslie, do you want to report out? Is that okay? I feel like that. Do you want to report?
You have not talked about it, and you
Um,
are the chairman of that committee, so you should do that.
What committee is it? This will be the Child Welfare and Regional Trends Committee.
sweet.
So we are just working, we met this morning to kind of establish what our goal would be for the year. I think we two would try to meet, in between each of our state meetings, probably virtually, but.
Well, I
really-
know you've done it one time before, because I was an hour late to get the fish plate.
That's okay.
I told you I have problems.
And so we're working on the continuity between, and developing the county, regional, and then informing our work, for the boards. So, we're gonna hopefully leverage Ms. Lamarva. I think maybe that would be our next step. We didn't really finish that well, but I think, our next call, maybe inviting Ms. Lamarva to talk through some of the ideas that we had today around beginning to establish that framework, looking at the handbooks, and just working on some of that for county and regional boards, getting those digital as well, and then, how this kind of all works together, the training too, going into those boards. That's, yep. Those are all the committees, correct? Okay. Now we will move to regional reports. And this go around, you all sent in your regional report for the executive committee. So we're not gonna go through them individually during the meeting. We talked about perhaps being more efficient this way. So we are gonna begin to try that.
I think that's good,
You like that?
yeah.
Okay.
Well, if we look at them, sometimes we don't. You know, there's ways.
All right, any closing remarks or anything before we adjourn?
I actually, I had a challenge from our region, so I'm not sure how we get those addressed. But one of those was, one of our counties lost a ton of CPS workers, and we're like pulling from different counties to help cover the load. And one of the things that the director mentioned was really challenging was, and it was really, it's in hiring. So, but what the hiring kept being delayed and pushed back because they wouldn't get their credentials. So they would send the equipment, but no one could log in or do anything for another 15 days before anyone would get login or able to actually go do work. So I think they were asking if we could adjust the process to ensure login credentials are issued along with equipment to prevent onboarding delays. So I don't know where we take that or.
We can circle up after this meeting.
Okay, cool. I'd like to have an answer for them, or at least go back with a result of some sort.
Absolutely. Any follow-up from this meeting we'll send to the whole group, probably a couple days.
Okay, great.
Give us some time to
All right.
take it with our people. Fair.
Anyone else? Closing remarks? Anyone online? All right. Well, thank you all for attending.